Today I'll be talking on in response to my earlier video, which I have uploaded a couple of days before on post-COVID-19 complications and AMR spread. On response to this video, some of my subscribers and friends, they raise a question, and that is a valid question, and rather it's a comment or it's a query, you may call it either comment or query, regarding when to use antibiotics. So because I have mentioned that not to use antibiotics on like a mild illness. So my only concern to mention not to use antibiotic was that the antibiotics should not be overused or misused. I did not say antibiotics should not be used. Obviously, if there's a complication and there's infection, severity of infection, you must use antibiotic, but under the prescription of the physician, qualified physicians. Second question was that they mentioned that to educate physicians, that is doctors. 90% doctors, which I suppose qualified doctors I'm talking about, they know when to use antibiotics, but they are bound to give and to prescribe long list of medicines, including antibiotics, to the patients just to ensure that patients are satisfied. This is the big question. Patients can never be satisfied if a doctor has just counsel him, say, okay, you are fine, you may be recovered in 2-3 days or 4 days, and there's no need to you go for antibiotics. So in that case, patients thought that the doctor is not good. That's general perception of the public that we have all around. As far as use of antibiotics are concerned, the antibiotics should be used only and only when infection confirmed. So having fever, mild fever, not necessarily be that you always need to use antibiotics, because fever may be because of flu, and many times we got a flu and having fever, and these fevers, mild fevers, or even high-grade fevers because of some flu infections. And in this flu infection, we contact with the doctor and he just prescribed medicines because he just wants to satisfy you that yes, you have to go through these medicines and then medicine will cure you. It is not because of the medicine. After completing a cycle of the virus in 3 to 5 days or even more, 7 days, the fever is automatically gone because the infection is gone, cycle is completed. So if there's no complications except the fever, you can avoid fever just by taking simple paracetamol or crocin or any antipyretic medicine. So my only concern was in that video not to use and overuse and misuse antibiotics. Of course, you have to use antibiotics on the prescription of doctors and physicians when it is really required. When it is required, the physician will tell you. So it's not a question of educating physicians, it's a more question here to talk about the education of the general public. We as a general population, which we visit the doctors, clinics, and ask them to give some medicines because I'm not well, I'm not ill, I'm ill and I'm not well. So you have to write a medicine and then doctor prescribe medicine. So in the simple flu and viral infections, of any kind of viral infections, taking antibiotics is not recommended at all until unless confirmed secondary infection established. What I discussed in my last video on post-COVID-19 complications, where we talk about the staying in the hospital for a long time may cause long stay in a hospital may cause secondary infections. Acquired infection, we call the nosocomial infections, are the infection acquired during the hospital stay, during intubation, during some health support or life-saving machines and so on. So in that case, if the infection is established as a secondary infection, then you can definitely get some antibiotics on the prescription of the physicians, qualified physicians, then probably you can. So in order to control AMR spread, avoid antibiotics, again I'm saying, for a small and short illness or a mild illness or flu or viral infections, just for a fever. Fever is because of, not necessarily always because of infection. It may be because of bacterial infection, it is maybe because of the viral infection. And many times it occurs because of the viral infections. So bacterial infections, when confirmed through either test or through physician's recommendation, then only the antibiotics will be taken. And I think this is what my concern was in my last video. And I again continuing here is that in order to avoid AMR spread and antimicrobial resistance, we must reduce the use of antibiotics and misuse of antibiotics. That is, non-relevant antibiotics should not be used on every occasions of illness. Thank you very much.